Welcome to Pathophysiology with Vargas Academy. I am focusing on the hematological disorders, which is mainly which has key points for APRNs, PAs, and nurses who is struggling to understand the pathological disorders and the hematological conditions. So this slides are generated with basics to disease conditions where you can focus on the clinical indicators and identifying them. So we have the first slide is components of blood, erythrocytes, leukocytes, thrombocytes. You heard these terms, so this is just broken down into basics. The key points are highlighted in these slides. Make sure you read them and understand the basics of erythrocytes and related to the lab values and what are the disease conditions that we in the clinical setting focuses on. COPDs, polycythemia vera, all of these conditions comes on state board exams very often, so I have highlighted them for you. Leukocytes is the WBC, which is the defense mechanism for our body. Left shift is commonly used in the clinical setting. This is a description of that. Leukocytosis, leukopenia also comes in the clinical conditions, so there is a description with examples there. Platelets, also called thrombocytes. So high levels are thrombocythemia or thrombocytosis. Low levels are thrombocytopenia. And here's pathological significance listed there also. Then we have anemia. Very common. A lot of my students have trouble understanding the different types of anemia. So I have classified this from the basics. What's the basic functions of hemoglobin and how hemoglobin direct a patient to get anemia. And the 4 important combination of causes of anemia are listed here. And H. pylori is comes on board exams. A lot of students does not know how it affects anemia. It impairs the iron absorption, especially with patients' gastric disorders, gastrectomy, gastric surgery, gastric hypochlorhydria, hydria, and all of these causes decreased absorption of the dietary iron from ferric to ferrous form. So this condition comes on board exam, and also that's a bacterial cause of anemia. Viral cause will be Epstein-Barr. These diseases comes on boards. So read these slides to understand the different types of anemia: macrocytic, microcytic, and normocytic. Macrocytic, the common cause, pathology, examples, diagnosis. How do we diagnose in the clinical setting is also described here. One of the key points in this slide is the principal disorder of pernicious anemia, which is a macrocytic anemia, is vitamin B12 deficiency. In mind, a lot of our patients comes to the clinic with multiple symptoms, and we do all these lab work, especially if the patient is a vegetarian. Know that this is an animal-based protein. So you have to think of supplementing these patients with vitamin B12. Patients with gastric surgery, autosomal autoimmune disorders, they also have a high risk for absence of intrinsic factor, which causes them to develop vitamin B12 deficiency. This comes on those exams all the time. The absence of intrinsic factor is the key here. And how do you diagnose them? With CBC and peripheral smear, and what are the clinical significance on that lab results? Hypochromic microcytic anemia. These are small. Hypochromic means small, pale color. Microcytic is small cell. Hypochromic means pale color. Defined as the RBCs are become very pale and smaller in size. Example, very common iron deficiency anemia, inflammatory diseases, thalassemia, both alpha and beta. It's also called the Cooley's anemia. And then another example is sideroblastic anemia. The pathological findings are outlined here. Please read through them. Very common in the board exams. Iron deficiency anemia. Very common in board exams and clinical settings. So you have to know how you diagnose them, what are the clinical indicators, what signs and symptoms are the patient presenting you with, at what level of hemoglobin would you be concerned or ask the patient to seek medical opinion. Here's the key points listed in the slide. The normal levels of hemoglobin is listed, and the key components, the clinical indicators are ferritin, transferrin, serum iron, and transferrin saturations. The seven indicators, you have to know these 7 indicators in the clinical setting to diagnose iron deficiency anemia. Then we have aplastic anemia. It is caused by bone marrow hypocellularity, and it can be from pancytopenia or any infectious process. Like it creates an immune response or an autoimmune disease against the hematopoietic system. So what happens is it triggers the oligoclonal expansion of the cytotoxic T cells, which destroys the hematopoietic stem cells. So that causes peripheral cytopenias. The hemoglobin will be lower than 10, and platelets will be less than 50, and the absolute neutrophils will be less than 1.5. So I also added the 2 types of aplastic anemia here, inherited aplastic and acquired. So you can just read through it just for your own understanding. And the clinical indicators are very important, and the cytotoxic T cells caused by the immune response triggered by a virus or a drug or whatever provokes that immune response. Okay? That's the key factor here. Then we have anemia of chronic disease, ACD, very common in the clinic. It results from 4 different categories of causes I have listed here. The mechanism is important to know. The cytokines and acute phase proteins play important role. And also it can cause alteration in the iron metabolism because of the molecule hepcidin and ferritin. Very important, these 2 terms. Clinical indicators are listed here. Please study these. How do you compare anemia of chronic disease with iron deficiency anemia is also important. So you want to make sure that you understand the difference, how to differentiate these 2. Also keep in mind sickle cell anemia is also chronic and it can cause low hemoglobin. So that's listed there. ACD and anemia from blood loss are under the category of normocytic anemias. Then we have post-hemorrhagic anemia. This usually occurs after a traumatic injury where patients loses a lot of blood. It could be from surgery, ruptured ectopic pregnancy, aneurysm, even DIC. So the pathological response will be reduction in oxygenation that stimulates the production of erythropoietin. And the clinical indicators will be hemoglobin drops from drop of 1 point to 2 grams, with common symptoms will be hypotension, weakness, dizziness, and shortness of breath. So this is an important slide. Usually ER nurses will know exactly what to look for when these patients come to the ER. And we have 2 hematological conditions. The key points are listed in these slides. DIC is often seen in the hospitals and clinical settings. You have to know how to diagnose them, the low platelet count, elevated D-dimer, and decreased fibrinogen, and prolonged clotting times. This is very important. The second one is heparin-induced thrombocytopenia. Usually patients are exposed to heparin for some way. So you have to know that it is an immune-mediated adverse reaction caused by IgG. So a key factor there, the hallmark is thrombocytopenia. Clinical indicators is important, listed here. How do you diagnose them? Common signs and symptoms. Some patients will have a skin rash consisting of red spot other than the tachycardia, shortness of breath, and chest pain. So this concludes the slide for hematological disorders. If you have any questions related to this, just email me. The link is vargesacademy2023@gmail.com. I will be happy to help, and I hope you enjoyed this video. Thank you.